Okay, folks, welcome to the podcast. I'm very happy to have Dr. Luke Pomerantz on. Dr. Luke, how are you doing?
I'm doing well. Thank you for having me.
I'm very happy, and like I just said before we started recording, for the longest time I wanted to have a doctor on who's also a martial artist, and that's you. So if please correct me if I'm wrong, but you're an orthopedic surgeon
I am an orthopedic
specializing,
surgeon.
yes, specializing in upper body extremities. So that would mean hands
Yeah,
and arms.
well, yeah, kind of the arm.
Okay.
I would say 2/3 of what I do is kind of the elbow to the fingertips. Um, yeah, so that's where I specialize.
All right. But you're also a BJJ black belt and you compete in MMA and boxing. So that's a really cool background. And I hope we can have a good conversation today talking about all the things that so many people in the combat sports and martial arts world have these ideas about, health, medicine, injuries, treatment, and so on, that in my humble experience is often completely wrong. So I'd love it if we could, a little bit later in the conversation, talk about some of the myths that are out there and misinformation. But first, how did you get started with training in martial arts?
Sure. Yeah, I'm definitely looking forward to see where this conversation goes. But so yeah, my journey into martial arts. I was quite young, and I think I might have done a taekwondo class or something when I was maybe 10 years old, and I even did a little aikido, um, which was valuable, and I learned how to fall. The roles I've carried on with me for a lot of things. Um, I guess, I mean, there wasn't a particular amount of pressure to do martial arts. Certainly, my parents were pretty good with kind of like, hey, whatever you're into, try it out, see how you do. And I don't recall exactly how I got into those. Maybe as a suggestion, and I tried it out. And um, I think I was drawn to things like martial arts and combat just for a few reasons. One of which being I was kind of small growing up. I was actually really small growing up, and I saw the importance of at least in my mind being a little more confident and knowing that I could protect myself, have for self-defense purposes. But I think something else that kind of resonated me within the world of martial arts was the discipline. Um, I've kind of had an inherent discipline, focus, I don't know, grit, whatever people want to call it. And martial arts was, I guess, rewarding in that if I was disciplined, I could see myself grow within that realm. And yeah, and then things just kept going.
And did you get started with BJJ first, or first MMA, or boxing, or what was the path?
Yeah, the path to that, I because I was so small, I started going towards sports with weight classes, and that was wrestling. So I started wrestling in what we call junior high. I was about 13 or 14 years old, I think, when I was first starting to do it. And um, one of my wrestling coaches, Garth Taylor, he he got into Brazilian Jiu-Jitsu. We were just fortunate with where I was growing up in Santa Cruz, California, that we had a Brazilian Jiu-Jitsu champion, Claudio França, moved to Santa Cruz. And so I was able to be an early adopter along with my coach, Garth Taylor, who ended up being one of the first American black belts. Um, and so it just introduced me to Brazilian Jiu-Jitsu. And then, we're talking now kind of early 2000s. If you were doing Brazilian Jiu-Jitsu, you were going to be around guys who were also fighting just because of that early UFC days and the Gracies and all that kind of stuff. And so I was around people who were fighting, and it kind of got to the point where I was in shape. I was decent with jujitsu, and my friends who were in the world of mixed martial arts were kind of like, "Hey, if you get in shape, we'll set up a fight for you. Show up." And so I did a couple fights, and they went well for me.
Excellent. And what was your experience with the fighting? Did you immediately take to it, or was it like overcoming the adrenal stress right before you have to
Yeah,
start? Some people, I mean, I've seen it with students that some of them they just take to it like a fish to water, and others is the opposite. They have to psych themselves up and really work at getting into the right headspace but once they do, then it's on, and anything in between. But what is it like for you?
Yeah. So I've always been drawn to competition sports growing up, and whether soccer, or baseball, or wrestling, or whatever, I've always been into competition. But I can say that I was one of those people who was way up in my head. There was a lot of anxiety before the game. I just remember times being so nervous and questioning, like, why am I doing this? Why am I doing this? Why am I putting this pressure on myself? Um, and then I was a little older, a little more mature, I guess, when I started doing the MMA. I was in my 20s when I was starting to do that, and I kind of saw it as an opportunity to work on that mindset. You know, why am I so anxious about this? And so I started really kind of working on trying to find what mindset would work best for me and the techniques to get there. And um, and it was actually in my MMA fights, the two of them, that I was probably in the best headspace that I had been for competition, just because of the work I put into it. What resonated with me was kind of, I guess, what they would call the a combination of positive mental imagery, maybe some cognitive behavioral therapy, where I'd be thinking about the upcoming competition. I'd feel my heart rate go up. I'd feel kind of the butterflies in my stomach, but I'd force myself to, like, all right, let's imagine how this fight goes. Maybe put myself in a bad place in that fight. Take myself all the way through the fight. And that kind of, from, getting my hands wrapped, walking down the walkway, the music going, the lights, the fight, putting myself in a bad place. And in the end, I always got my hand raised. And so by the time the competition actually came around, I had been through 150 fights already. And that definitely helped with kind of the anxiety and the doubt that surrounded a lot of my earlier competitions.
Yeah. Yeah, it makes sense, and there's a lot that changed in the last few decades on that front. I mean, way back when I competed, there was not that much information about it, like you explained, mental imagery and mental preparedness and so on. It was more like just shut up and train and show up for the fight. But nowadays, you have mental coaches and all these things that I think are important. It's just that there wasn't that much of I guess professionalism maybe in the sports back in combat sports back then. It's a lot better now, but still every now and then you hear UFC athletes say stuff like holy crap, please don't do that. Please don't give this advice to
Yeah.
young fighters, because that's a horrible idea. It may work for you, but that is against everything
Yeah.
that we know about sports science and so on.
Right. No, definitely. I think all sports, they've kind of realized the importance of the mental side.
Yeah.
And, you've got these elite athletes who are all extremely good athletes, and all of them put a ton of work in. And so often the last little edge is having the mental side that much more dialed in. So yeah, you talk to, I mean, even in colleges in the United States here, they've, some of the bigger departments will have a sports psychologist around. Just shows how important it is, finding that competitive edge. And there's lots of different ways to it. And I've always been jealous of the guys who their mind was already in a good place for whatever competition it was. And I just see guys who, in normal life, they were normal people, but man, when it came down to, like, all right, it's time to go, they just had that switch.
Yeah.
And they were ready. And that's not how my brain worked. And so some people just have it. Some people have what it works, and it's probably different for each sport. But I think just as important as putting the time in the gym and getting your reps in with technique is getting your mind right too.
Yeah. There's an older book, The Science of Martial Arts Training by Charles Staley, which I read many years ago. And I think has a really interesting take on training. And if I recall correctly, he calls it like the training hierarchy, the pyramid. The bottom parts of the pyramid is where you spend most time, and they support the top parts. And the absolute bottom part is just physical training, or speed, power, flexibility, all those kind of things that you need to have to the highest possible level, so you can get to the next level of the pyramid, which is technique. So you don't waste all those attributes that you train so hard for. But that technique is then going to support the technical tactical level. It's why do I do something, when do I do it, when not, and so on. when do I change tactics? And that one, in total with all the other ones, is going to support the top of the pyramid, which is the psychological and mental aspect. And what I really like about that concept is that you've seen this as well. If you go to the gym or BJJ class, a guy shows up, and he may have some technique, but he hasn't been training for a long time, totally out of shape. Start rolling, and after like 5 to 10 minutes, like you're dead. Yeah, it doesn't matter how great your technique is if you can't last, if you don't have that physical attribute. And on the other hand, you can have all these steps well taken care of in your training, but then be riddled by self-doubt and psychological issues, which we've also seen. Even professional fighters just break down in the middle of a fight and just mentally just check out, and it doesn't work
Yeah.
anymore. So I'd love to hear your thoughts on this concept of this hierarchy of training as he describes it. Does that make sense to you?
Yeah, it makes a lot of sense. I mean, the pyramid that you described, I would have to say, is kind of along the lines of my own personal experience with it. Yeah, I agree with kind of those levels of conditioning and attributes to the technique, and then this tactics and strategy to the mental psychological stage, and that's yeah. I mean, I totally agree with that model in my own experience, and I was very good at being in shape and building the attributes the best I could and learning the techniques. Strategy, I was pretty good at thinking. I could formulate stuff, but then the problem would come when I would start overthinking things. And I stopped. I didn't want to watch tape on my opponents. I didn't want to overthink things, because I would start getting way into my head, and then I would get away from the things that I'm good at when I'm thinking about the stuff that they do. And yeah, so it was that kind of last part, the psychological, which probably bled in a little bit with the strategic stuff, where I struggled the most. But yeah, on the lines of, man, doing jujitsu, there's those guys who they come at you as hard as they can, and at 1 minute in, they gas out.
Yeah.
And then it's you start trying to, all right, well, I'm going to impose my will on you now, and then they give up. There's nothing more annoying to me. If you're going to come at me like that, you got to be in this for the 5 minutes that we're going to, the clock's going to go. It just drives me crazy when their conditioning's not there, but they want to give it to you.
Yeah, I think it's just the what is it called again? The spazzy white belt syndrome, where they're just all over the place, and then all of a sudden, like you said, they gas out, and it's okay. Well, I'm done. Okay, you can do whatever you want. I'll tap. I get that to a certain degree, but on the other hand, it's maybe not the best way to train because you're not learning much. And I have to raise my hand in a mea culpa. I recently started, BJJ training again, and it's been many years due to a variety of reasons. And started rolling again. It'd been a while, and I was having way too much fun. So I'm putting too much, strength and effort in there, as opposed to trying to go for good technique, and just having way too much fun. Very sore a few days afterwards, but under I quickly realized, thankfully, that okay, I'm a heavyweight, so I've got my size and strength advantage over most people there, but that's not a goal. It's I'm not supposed to tap people with stuff I already know. I want to tap people with things that I learn in class, so I can actually get better at this stuff, as opposed to do things that I already know how to do. And I think that lesson is for a lot of white belts. It's like, okay, just be humble, and then at the same time, maybe focus on technique first before you go nuts.
Yeah. It's hard. I mean, everyone's got an ego, especially in the beginning. And you don't know when you can conserve energy and all those kinds of things. But you bring up a good point with working on the techniques that you learn, having an intent in the way you train. And even I slip into bad habits of, I'm just kind of happy to show up, be there with my friends and get some exercise. But it slows the progression of learning the art, because you're not like, hey, today I'm working on this, or, oh man, I got exposed with this position. I've got to work on that. And coming into the training with intent is a way you're going to progress much faster. It kind of sucks if you're getting beat up because you're working on stuff that you're not so good at. But if you're able to close the gaps in your game, then you're going to be that much better and you're going to advance that much faster. And certainly bringing intent to the training is important.
I really liked one of your Instagram posts where I forget who you were rolling with, a really big, strong guy, and you in the description you kind of explain it that okay, this is like the third time in 5 minutes or something that he tapped you, and you're like, okay, this is humility, and I think for that, grappling is one of the best things that it there's no doubt when you have to tap. It's like you can say whatever you want afterwards and explain it away, but no, he got you. You had to tap because you were not getting out of that. So it teaches humility in a way that I think striking arts don't do as much. Because my experience with, if it's an ego thing, you throw a punch, a kick, whatever, and you're pulling it because you don't want to injure the guy, and he then basically ignores it and then just clocks you. Whereas, so you're inherently more limited in teaching those humility lessons to certain people, unless you're like, I don't care, I'm just gonna start putting it on this guy, which I don't think is a good way to be with students. Whereas with grappling, it's like, no. This is you are turned into a pretzel, whether you like it or
Yeah.
not, and you're just gonna have to admit that this guy is better than you, and then you can learn.
Yeah, no, I agree with that too. It is, yeah, I've tried to put this into words, but grappling and submission arts like jujitsu, it is much easier to really impose that will on someone where they know, okay, yeah, it wasn't a lucky submission where they controlled me for 5 minutes
Yeah.
straight and I couldn't move and couldn't breathe and then they choked me. Like, there's no way of like, oh, he got lucky. Whereas in the striking, sometimes you get caught with a punch and it kind of came out of nowhere and oh, it was lucky. It was a lucky shot. And then, like you were mentioning, if you're going against a guy that you're way better than, you don't want to hurt him. You don't want to knock him out or give him a cut or something like that. So yeah, you're going to hold back a little bit, but they may not know it. So I agree with those points entirely. And yeah, I mean, martial arts in general, they bring humility, which is important for just about anything. The instant you think you know everything about anything, you're done. You're not going to learn anymore. And so humility, and I will try to find it. I've been inspired to try to roll with the best guys I can roll with in jiu-jitsu, and I'm very fortunate to be in San Diego where there are world class guys all over the place. And the gym I go to frequently, we have these guys come over and visit, and that was probably Sloan Clymer who's beating me up,
Could be, yeah.
and I would like to say it's because he's way bigger and stronger than me, but his jiu-jitsu game is really, really good too. And um, I've been training for a long time. I'm half decent at jiu-jitsu, but there's sometimes where it's just like, man, I have so much more to learn and so much
Yeah.
more ways that I need so many more things to work on to get better. And it keeps the sport fresh and always more to learn.
And now, and I wanted to ask you that in specifically because as a black belt, obviously you've put in a lot of time and effort. So, what keeps you going to not be like so many guys that are out there in martial arts in general that are like, okay, got my black belt, I've got this and that. So, not really thinking I'm the man, but more along the lines of like, okay, I've arrived, and then they kind of settle into this routine of, yeah, we're still training, but progress is whatever it is because I'm a black belt. Whereas I think the really interesting part only starts typically when you get to these higher levels where you can go for much more nuanced things that you don't necessarily understand at first, when you're a lower rank. What keeps you going? What motivates you to just push? Is it just because you're having fun, or is it like you said, meeting other people who are really good? What drives you on?
Yeah, it's a combination of more than a few things. It definitely was not about getting the black belt. The outcome that I was looking for was not the black belt, and if that's people's goal and they get it, then yeah, I guess I see why there's not much else to go. But it's definitely the process that I've really appreciated. And there's so many things that go along with that, the exercise. I love getting exercise. That is exercise. I've got really good friends at the gym. It's fun to see them and hang out with them and talk about other things, not just jiu-jitsu, but you get to learn stuff. You get to teach each other things, and all those things are fun. And then within the sport of jiu-jitsu, just the knowing that I don't know everything and I want to know more. And those moments where something clicks and you're able to use a new technique against a guy who's really good, that reward has been something else that keeps me going with the sport.
All right. Let's take a left turn a little bit. Were you always planning on becoming a doctor, or how did that come about?
Yeah, so going into medicine, I guess it was an idea in the back of my head before going off to college, but it was never a serious consideration. But it was enough that when I went to college, and I had done well in school, but I kept the door open. I was kind of doing the pre-medical classes, a lot of it because it was stuff I was going to have to do anyways for the interests I did have. I was into biology, I was into things like that, and so doing the pre-med classes and seeing that I was doing well enough, the door was still open, and a combination of wanting, being raised to want to help people, and a sense of altruism and wanting to be part of a community and contributing to that, with kind of an interest in the human body and how it works and how to improve it. Partially because of how small I was growing up, I really was trying to find every edge I could. So I was kind of that little kid in the library trying to learn about nutrition or lifting weights or things like that. So I was I had an interest in the human body, and it just kind of leaked over to, all right, I can combine a lot of things that I like: helping people, the human body, gaining more knowledge. And so when I had done well in college enough on the pre-med stuff, I kind of locked in and started going after it. I originally thought I was going to go into emergency medicine, and that was partially because the TV shows that are out there, and the excitement of the emergency room, and you're doing all these different things, and the way emergency medicine is actually applied, especially in the United States, is not as glamorous as they portray on TV. And I realized I was really into procedures. I liked doing an actual thing and then having an outcome that you could measure. And so I started going towards surgical fields, considering those. And throughout all of this, the people who knew me, who saw that I was into sports and a jock, and they thought I was going to go into orthopedic surgery. And I didn't really know much about orthopedic surgery. I hadn't had a surgery myself, and that's usually how people get into orthopedic surgery: is they're an athlete and they get hurt, and then they meet an orthopedic surgeon. I hadn't had that experience. I didn't know much about it. But when we went through our kind of mandatory rotations in medical school, it just clicked. Working on bone and muscle and joints, using tools that made a lot of sense to me, with not only just a scalpel, but hammers and nails and chisels and things like that. In a sense, carpentry. Using my hands, and the experience of the little old lady who fell and broke her hip, can't walk. You do the surgery you need to do, and the next day they're walking like that. That's an experience you don't get in medicine all that much. So that's where I started going towards orthopedic surgery.
Nice. And what got you started with social media? I mean, you've got. I'll put links in the show notes for this episode. For the people who are listening later, that's going to be wimsblog.com/ and then the number of these episodes. So I'll put all the links to your YouTube and Instagram and so on. What got you started with the work there, which is a lot of explaining, and I'll give some examples of typical injuries or issues that you might have as you train.
Yeah, getting into social media, I was very resistant. I was definitely not an early adopter. Um, but I started to see that there was some benefits to it. First, it's nice to help patients. They come to my clinic. I talk to an individual. I talk to them about their problem, and when maybe hopefully that person's helped, and go through the patients throughout the day, and then maybe do a surgery and help people through the surgeries and those kind of things. But I started to see that within social media, you could reach out and inform and educate and hopefully help people on a bigger scale. And so that became an interest. Also, kind of maybe creating a quick video, it might make it so I don't have to explain as much to a patient in clinic. I could just like, hey, for more information, I've made this video. So that combined with just the realization that social media is part of our world now, good and bad, and the statistics of whatever it might be, kids, ages 15 to 25, the only way that they're finding information is through Instagram or TikTok or YouTube. And if you don't have a presence there, you're missing out on patients that you would otherwise like to see and treat. So a combination of all of those things kind of led me to finally, all right, we're diving in, we're doing this.
And I really like it because a while ago I interviewed Dr. Mike Piekarski, and
Yeah.
one of the things we talked about from obviously his specialty, um, treating injuries and so on, and getting people back on the mats and back in training. He mentioned that, and I think that's a really good point. And I've been working as a personal trainer for almost 30 years now, and it's one of the things that you get people who ask you medical questions, and the first thing I say, I'm not a doctor, go see a doctor. I'll tell you what I think might be going on from my experience, having had a bunch of clients who had similar issues like you have. But again, go see a doctor. And that was what Dr. Mike said was like, get an assessment. Don't just listen to some guy on social media who says something. And the one that annoys me the most as a personal trainer is I see younger colleagues have a very large following on social media, and then they post this exercise or stretch or whatever. Doesn't matter what it is, might be awesome. It's not the point. But then they're like, I've been doing this for 5 days now, every day for 3 minutes, and my back pain has gone away. I'm like, I'm right here with my bulging discs and all my other stuff. And then if I do that, I'm off to the hospital. So like zero context, zero nuance, zero pointing like, okay, go see doctor first before you do anything. Does that drive you mad as well when you see people see that stuff?
Definitely. Yes. Unfortunately, the algorithms and the nature of social media, it encourages kind of the big statement, the flashy thing. There's not a lot of room for nuance. And unfortunately, with healthcare and, well, just with anything, there's nuance and subtlety and things like that just aren't being rewarded to being said. And it's unfortunate. And I guess another catalyst for me to start putting things up on social media was a frustration of seeing just blatantly wrong things. I don't think it was disinformation, but maybe certainly misinformation. And it's kind of like, well, maybe if 5 people watch my video, they'll have, be that much more informed. And the 5 million people who watch that other video, well, I don't know, but yeah, it's the pluses and minuses of the world of social media. And I hope, or I wish, there was more room for nuance and subtlety. And I don't know how to build that in other than me try to put a little out there.
Yeah, and that's why I wanted to have somebody like you on for the longest time, who is a doctor and an orthopedic surgeon at that, but also a lifelong martial artist, and having experience competing and those kind of things, which is obviously another level of training, and you understand guys who are on the mats or stepping into the cage much better, and can talk from your own experience to them, and they're like, okay, this is me talking as a guy who also competed, but this is me talking as your doctor, and saying like, you can keep going that way. and then this is going to be the end result. I fortunately had that with my son, who wanted to be an MMA athlete, but he's born with a hip issue, which it's minor.
Mm.
You wouldn't know unless you start doing a lot of stretching and trying to do high kicks. And I'm very fortunate that one of my good friends is also an orthopedic surgeon and a lifelong martial artist. He's a ringside doctor, MMA coach, and so on. And he's very kind. He said, "Look, you can keep going, but by the time you're 35, you'll have maybe your second surgery, and by the time you're 40, maybe you won't be able to get out of the car anymore unassisted. So maybe that's not the best way to go." So he went to a hip specialist afterwards, a colleague of my friend, and he said, "Look, as long you can do high kicking and so on, not a good idea, but BJJ, don't have guys in your guard and play there all that much. Let them pass your guard if need be, but if you're pain free, you can keep going." And he's been doing that for a few years now, and knock on wood, it's so far so good. But he'll never be able to do splits. He'll never be able
Yeah.
to do certain things in BJJ, and MMA career, that's out of the question. And BJJ competitions also, the intensity of the training. I mean, the risk of severe injury is way too great. And then you're lucky if you can talk to a doctor. So like, dude, I know exactly how you feel because I've competed. I know what it's like. I know what
Yeah.
I want to do. But for you, look at the X-ray over here. This is your hip. This is the problem. We can't fix that. So that anyway. Long story short, that's why I want to have professionals on the podcast as much as possible to get rid of some of the myths and misinformation that is out there, even by people who mean extremely well, and who also might have valid experience and information to share. Just like you also just said, is there's not enough nuance, which any doctor will say whatever exercise regimen or rehab treatment or procedure that you will advance as a good solution, whatever problem you add, well, there are contraindications, and here's the list of things, of reasons why we wouldn't do it. And that nuance is what I miss the most. But I'll get off my
Yeah.
soapbox.
Yeah. Yeah. Well, sorry your son had to, go through all that with the hip and a little change in what he had hoped to do in life, but glad he's still active and doing things. Yeah. I guess, yes, being a person who's experienced the things that my patients are going through or trying to achieve is definitely helpful. Being able to kind of take that side of it, and it's kind of universal. I'm sure you've been around it and seen it, but there's nothing more annoying, I think, to athletes when a doctor tells them to stop doing
Yeah.
their sport. That's not an option, to stop doing the thing I love doing. So I try to come at it with some nuance and discuss the pros and cons of doing certain things, and maybe helping them work around the injury so they can still stay involved but still heal. And all you can do is inform people and hope that the decision they make is one that they can be happy with, because they're as informed as they can be.
Yeah. And speaking of informing people, I wrote a few examples down of some of the YouTube videos and Instagram videos that you've done. And if you could just, talk a little bit, you don't have to go obviously in the full detail that is in the video. I'll refer people to watch that. But could you explain acute compartment syndrome
Oh,
and when that could happen?
sure. So an acute or more recent video about acute compartment syndrome. So compartment syndrome, um, it's what can happen when there's excessive swelling, and there's these compartments made of fascia. If you're into physical therapy or heard of myofascial releases and things like that, it's that fascia that surrounds our muscles, and it's not very stretchy, but muscles tend to expand. They expand just even with getting extra blood flow when you're exercising. But trauma, usually trauma, and it's usually significant trauma, a broken bone, or it's happened in mixed martial arts, repeated leg kicks generates a ton of bleeding, and that's swelling, and the compartment can't expand. And the tissues that try to expand against that fascia can't expand anymore. They start enclosing on important structures. Those are blood vessels and nerves. And if blood can't get into the compartment anymore, things start dying. And it's one of the few true surgical emergencies within the world of orthopedics, something that you can't wait any time on, because pretty quickly tissues can begin to die and there's irreversible damage, and it can be catastrophic.
Yeah, there's like you said, the examples of Anderson Silva and Chris Weidman breaking their legs, breaking their shin bones, Conor McGregor not that long ago. But also for some of the folks, if you remember, Jose Aldo fighting Uriah Faber, that was there's a video I think titled "Leg
Oh
Kicks
yeah,
from Hell" or something along those lines,
yeah,
where he
yeah,
just
yeah, yeah.
leg kicks the crap out of Faber's leg. I mean, mad respect for Uriah to keep on fighting, because it's like, oh my
He's a
god,
tough dude.
yeah.
But that is one of those situations where, as a physician who maybe is examining Uriah after that fight, you are
Yeah,
making sure that his pain's under control and he's doing okay, because that is a situation where compartment syndrome can come up. And with the other examples of those tibia fractures, whether it's Chris Weidman or Anderson Silva, tibia fractures are kind of the classic situation where a compartment syndrome can come up. Just part of the anatomy of the lower leg is such that it's more likely to happen than in that location than other places. And a tibia fracture certainly meets the criteria for trauma.
yeah, and then some. And if you could talk a little bit about chronic exertional compartment syndrome, which is what I had. I had surgery for that about 10 years
Huh?
ago. Went undiagnosed for many, many years. The end result is massive problems, and now I'm just with arthritis and a bunch of other stuff. Um, but over the years, I wrote about that on my blog. I think about, yeah, almost 10 years ago when I had my surgery. Um, my experience with that is that it seems to be relatively difficult to diagnose, because it is very similar to many other things, which means that so many doctors miss it. I was extremely fortunate, after for almost 2 years trying to figure out why I was in so much pain all the time, that I found the doctor who does the fasciotomy surgery about once a week. He said, I recognize the symptoms because I've been doing that surgery by accident for a while now. But he says many of my colleagues will miss that. I've
Yeah.
had people contact me over the years, like, okay, I finally know what's wrong with me. I asked my doctor, could that be it? They did the tests and I said, yes, it is. And now I'm finally getting some help. Um, is this more
Was it your?
prevalent now? Sorry, go ahead.
I was gonna ask. Was it in your lower leg?
Yeah,
Where was
yeah.
your? Okay.
So I have both legs. I had full fasciotomy, both sides. So, two scars on inside and outside, and then
Okay.
with the fork, I guess they ripped it all open. Um, and it's better now, but I was basically with my ankles bone on bone, because everything had collapsed. My knees
Huh.
were collapsed, my hips were collapsed in, spine, everything was messed up. So I've been rehabbing basically every day since, for the last almost 10 years. I'll never be good anymore, but this it's I refuse to quit, and I keep on going. And despite all the injuries, I can do a fair amount of things. So I'm happy with that.
Yeah.
But I would very much hope that anybody who's in martial arts, where overtraining, which is what was told to me, is one of the key reasons why it tends to happen, where overtraining is so rampant. How can people recognize that? What should they be on the lookout for?
Yeah. So chronic exertional compartment syndrome, as you're talking about, it's similar in acute compartment syndrome, but it's something that will get better with rest. So those compartments that expand in response to exercise, extra blood flow, the muscles start expanding. They hit up against that fascia, can't expand anymore. It starts compressing the blood vessels, and your tissues can't get enough oxygen, and that hurts. It is relatively rare, but as you're talking about, it's probably underappreciated. Um, Perhaps doctors are missing it, it's not on their minds to think about as something like that. That something like that might be going on. Certainly, it's recognized in athletes who are doing things that are more repetitive, running. Certainly, the military has a population that it's known that exertional compartment syndrome is something that can happen. But at the same time, it's really hard to diagnose. One, the people who are around the person who's feeling it may not be thinking about it. Two, the patient doesn't know about it. And then even if the doctor's starting to think like, oh, this could be something, the objective criteria to get the diagnosis is hard to obtain. You have to, I mean, some of the criteria, the most accepted criteria is actually measuring the pressures of the compartments during, or which is really hard, during exercise, but that's one way, or right after exercise. And that's the facilities and implement the tools just aren't there for these tests to be done right after an athlete's exercise. So it can be a hard diagnosis to come by, but it is real. And treatment, you've been through it. If you want to keep doing the things you're doing, and often it's not an option to stop for some of these athletes, fasciotomies, you open it up, you release the fascia, which then allows the tissues to expand and the blood supply isn't compromised.
Yeah, and the test for those who want to know is then you have to do what I had to do was on a treadmill run for X amount of minutes and to get a good blood flow in my lower legs, and then they stab you with a needle which has a measuring unit on it to see what the what the pressure is inside. It wasn't
Yeah.
as bad as I make it sound. It's okay. If you can handle punching, getting punched in the face, or somebody trying to, doing rip your head off and choke you out or break your arm, you can handle that little stab in your leg. It's gonna be okay. So get the test done if you're.
Yes. Good. Well, yeah, I'm glad the experience wasn't horrible for you and that you've been helped. And I guess you kind of brought up how you've been dealing with this problem for a while, and it kind of took a toll on on the joints around on your legs, in your legs. And it is really interesting at how our bodies, in trying to accommodate and maybe push through injury, your mechanics change, and the way you run isn't as physiologic or as with the mechanics you should have, and it causes other things to break down. And we see that a lot, and it's sometimes people refuse to work through things, but for the most part, people will work through things, and it changes the mechanics and cause other issues. And that's a big reason why I push people towards doing physical therapy. The physical therapists are the ones who can work with these patients day to day or close to much more frequently than I can, to one, recognize the imbalances that have come up and then strengthen things, to hopefully prevent other injuries from coming up as patients have worked through one problem area.
Yeah, that's the biggest lesson that I took away from it is that how everything's connected, and just like you said, is that just your gait changes, your body mechanics change sometimes radically, not necessarily very very quickly, yeah, and you often don't notice it, but it's all of a sudden when you are doing some, let's say, mobility tests or strength tests and so on, and you notice that, oh my god, I'm not flexible here anymore. It just doesn't work anymore, or I've lost so much strength in this movement. I used to be able to this and that, and that's now gone. Why? Well, your body changed to accommodate that injury and find a way to keep you moving, not necessarily in a good way. What I found is that doing the rehab, I can do rehab like a world champion by now, because I've been doing it many times, and I've had shoulder surgery. I've had a bunch of injuries over the years, and I was congratulated by my shoulder surgeons, like, this is the best we could have hoped for. I'm like, I'll go to my physical therapist, who fortunately for me lives down the street, and I'm like, but I'm here again. Something else broke, and we do it. And I ask him, like, can I do this at home? Yes. I say, how many times? You can do it 3 times a day. I'll do it 3 times a day. I don't care, because I know you've got one shot at rehab.
Yeah.
And after that shot is over, that's going to be it for the rest of your life, unless maybe some new surgeries. But eventually we get to this point, that there's not many good options left. That here's something that I use with clients, and I'd love to hear your take on it.
Sure.
The way I often explain it, because it's difficult to see the lifespan of a human being from beginning to end as a human. We don't because we aren't that old yet, so we can't really predict what it's going to feel like. But we also don't really have a good sense of like, okay, this is how it evolves. And somebody can tell that to you, but especially if we're young, we think we're immortal and it's always going to be, full of energy. So what I try to explain is that, okay, you've got a serious injury now. You're 35. It's fine. You're strong enough to get over it and maybe have surgery, and you don't want to do the rehab. Okay, maybe it's going to be great, maybe not. Most likely with the rehab, it's going to be better. But let's say you don't do the rehab and you re-injure it, and then it becomes a chronic problem. And then bit by bit, you get closer to this point where all the easy solutions are gone, the ones that can really get you back on track to as close to 100% as possible. And what is left is now a more serious intervention. And then the same cycle repeats. If you don't take it seriously, you don't do the rehab, eventually you're going to have problems again. And if we get to the next stage, and there's even more serious surgery or medical procedures have to be done. And that keeps on going until you get to a point where the doctor has to say, there's nothing we can do for you anymore. We're done. And you're just going to have to live with all the pain and all the problems that you have. And my job as a personal trainer is often, in the third line. You've got the doctor, you've got the physical therapist, and then every physical therapist says, do your exercises at home. Nobody does that, or almost nobody. And then often clients end up with me. And then I contact the doctors and the therapists and so on. What can we do? What can't we do? And my experience is that so many people don't understand that concept of these hard limits to treatments, that once you get past that limit, it's going to be another one, and eventually you're out of options. Does that make sense to you?
Oh yeah, no, it's a great analogy, and we see it all the time. Within the world of orthopedics, I guess one example could be arthritis. There's a lot of things that maybe have happened before. A patient initially hurting their hand when they punched a wall, and their hand's swollen, and they never get X-rays, and they just kind of tough it out. And now they've waited a few months, and the hand still hurts. And then they see me and get X-rays. It's like, oh man, you broke this 2 months ago, and I mean, the surgery now to fix it is a lot harder, and the rehab's a lot longer. And they go, okay, well, all right, let's do it. And okay, I do my surgery. I do the best I can as a surgery. I'm like, all right, now you got to do your hand therapy. And they don't do their hand therapy. And they come back to see me 6 months later. And now they're super stiff. And, so it just kind of creates this cascading thing. And it gets to a point where like, look, you're just so much worse off now than if you had just taken care of things in the beginning. And in the world of medicine, I mean, whether it's diabetes or whatever, I mean, there's all these things that people can do early on to prevent these horrible things from happening later on. But like with diabetes, eventually people lose their limbs, their kidneys die, they have a heart attack, they have a stroke. But things have been going on for decades before that. And so, yeah, I mean, just a little intent and being aggressive with taking care of yourself early on prevents all these horrible things from happening later on. So, yeah, I see it all the time.
I can imagine. I mean, isn't it frustrating sometimes for you that, and obviously, you can't really talk about specific patients, obviously, but you spot that right away, like, okay, there's a patient that comes in with an issue, it's going to require surgery, and where you kind of very quickly feel like he's not going to therapy, he's not going to listen to me. Do you get that sense, or am I, going too far with that?
Yeah, no. I mean, yes, you try to treat patients as an individual. Orthopedic surgeons are notorious for kind of just looking at an X-ray, seeing, say, a broken bone, and going, "Hey, I'm going to fix that broken bone." But yeah, there's a lot of things that we should be keeping in mind, and some of it is the patient and what they're going to do. You certainly don't want to make judgments based on appearances or things like that, but you talk to them and you lay it out. Like, I mean, there's certain surgeries, certain cut tendons within the hand, flexor tendon injuries. And I tell them, I can put the tendon ends together. I can fix this. But if you don't do hand therapy, there's no point in me doing surgery. And most of the time they're like, oh yeah, I'm going to do therapy. I'm going to do therapy. And then, there's a significant amount of the significant amount of the population that doesn't do it, and they get a bad outcome. And it's kind of like, well, it is what it is. So you want to provide the best care to people through educating them, letting them be part of the decision-making process, keeping them as informed as possible. And then, of course, doing the best that I can do, controlling what I can control. And then some of it's going to be on the patient. But there's definitely times where it's clear after talking to a patient, they are not going to do the rehab. Sometimes they even tell you, like, look, I can't do it. I'm not going to do it. I'm going to be leaving the country, whatever the reason is. And you kind of go, look, me not doing the surgery, this is where you're going to be. Me doing the surgery and having complications, this is where you'd go. Perhaps it's best to not do the surgery. And that's the decision that sometimes we come to.
All right. Another video that you made, another post that you made was about a peri-fracture, also called a nightstick fracture. This is one of my pet peeves, but I'm going to let you explain it first.
Okay. Yeah. So in the United States, we tend to call it more of a nightstick fracture, but I like the term peri-fracture because it's a more encompassing term in parrying a strike. You're deflecting a strike, and it's classic for a person to put their forearms up in front of them to block a strike. And in the United States, I guess people were seeing it with nightsticks or billy clubs, and people trying to hit, a stick coming down onto their hand. And but it's classically a fracture of the ulna, which encompasses kind of the hinge joint of the elbow, and then it's the smaller bone down at the wrist compared to the radius next to it. But it's kind of the post of the forearm, what our radius will rotate around. And classically, the nightstick or peri-fracture is kind of the third of the bone that is closer to the wrist. But I kind of include all fractures of the, well, not all fractures of the ulna, but many of the ulna fractures fall into this kind of criteria as a defensive peri type of fracture. And depending on how much the bone has moved or shifted, displaced, sometimes surgery is necessary. But in combat sports athletes, certainly in mixed martial arts, we see quite a few of these. The kick, that shin kick that they take onto one forearm and it breaks. You'll see it mid-fight sometimes. They're trying to shake their arm out. They're not using that arm very well during the fight. Some of them even finish the fight, and they come out and go, yeah, I broke my arm in that first round blocking that kick. And so it's a fairly common injury.
Yeah, well, I tell my students to do the double block. Don't single block high, especially high kicks, because in MMA you don't have shin guards. And I mean, everybody always talks about the power of the leg kick. I'm a huge fan. I wrote a book about the leg kick. I'm a huge fan, but don't underestimate the power in high kicks because that is a very long lever that can be used to develop a tremendous amount of power. And you're fighting somebody who's probably spent a lot of time developing that power if he actually tries to do it during a fight. Most often, they know what they're doing. If you just hold up one arm to block that thing, I mean, look at his shin bone, look at your forearm. Which one do you think is going to win? And if you really need a visual for that, there's plenty of videos online where you can see people, kicking through baseball bats with their shins and so on. So please, pretty please, with sugar on top. I mean, do double blocks. It kind of works. It still sucks to get hit like that by a shin.
Yeah.
But at the very least, you have more of the absorption and kind of like the airbag effect that slows down a kick a little bit more, as opposed to this rigid block that is just gonna snap. I mean, one that I saw a few years ago was a guy. He didn't hold it up just straight like that, but he put his hand up against the side of his head, and that shin came on a little bit more in a downward angle, and it just snapped his forearm in half.
Yeah.
So I'm like, folks, I mean, it's not news. We know this happens.
Yeah. I mean, there's a reason why people teach techniques, and maybe sometimes those reasons kind of get lost. Teachers going like, hey, have both hands up when you're blocking this kick. And the student's like, okay, all right, I got it. All right. But if you don't know why, or you don't see why, certainly maybe the technique doesn't get in there as well as it could. Yeah. And it's crazy. Going back to the Weidman and the Anderson Silva fights, I mean, them breaking their tibias throwing a kick. I mean, that's such a tremendous amount of force that they're throwing with their kicks, and it broke their bones. And fortunately, they didn't get compartment syndrome. But man, the force that these guys generate with those kicks, yeah, it's kind of surprising that we don't see more peri fractures in these
Yeah,
sports. But maybe they're using good technique with
it's
blocking them, with
it's.
parrying them.
I mean, the Anderson Silva one. Okay, that's one. I get it, but Chris Weidman, he should have known better. I mean, he opened up with a full bore leg kick, no preparation, no feint, no setup, nothing. Just
Yep,
first
yep,
move, step in, and Uriah Hall is not a beginner. I mean, he just braces into the wall block, and you can
yeah.
see that shin is just in smithereens. And I'm like, dude, I mean, at one time you were champion. You should know better. And respect to anybody who enters the cage or is on the mats. It's not the point. It's just that at that level, I don't get why you would throw a naked leg kick like that. I just don't get it.
Rough lesson to learn for sure.
Yeah, that's really. I mean, has he fought yet? I don't think he's fought yet since then. There was talk, I
It's a
think,
good
about him
question.
fighting, but and it's been a few years
Yeah, yeah, it's been a little while. In general, those tibia fractures, we usually fix them by putting a big metal rod down the center of the bone. It's a great way of fixing them, and it allows the bone to be healed fairly quickly. Within a couple months, they're putting weight down also pretty quickly, and the rehab goes pretty quick. Um, and just based on other athletes who at a high level get back to sports, it's at least 6 months before they're training hard, which means they got put in a big camp, which means maybe it's 8 months at a minimum before they would get back to sport. But a year is not
now.
yeah, it's certainly expectation sometimes.
A different question. Could you go over some of the injuries that you often see martial artists and combat athletes have? Some common injuries, and just from your perspective, some general advice, like, okay, if this happens, go see a doctor. And this is about, like you just explained, you can expect about 3 months rehab before you can train again or whatever.
Sure. Yeah, we can go through a few. Um, I'll try to provide some nuance, but at the same time, not bog the conversation down a little bit. But going with one of the most common injuries in anything is the ACL, anterior cruciate ligament of the knee. Um, Very important ligament to stability. It helps keep the shin bone and the femur bone in relation to each other. The shin bone wants to go forward, and the ACL kind of restrains that. It also helps with some of the twisting restraints of the knee joint. And you'll see the injury happen even without impact. Certainly, a rugby tackle, football tackle, and someone kind of coming into the knee will tear the ACL. But sometimes it's just someone landing while jumping or making a cut on a field, and that ACL goes. There's usually clearly pain when it happens. The patient will notice instability, meaning the knee kind of sloshes around when they're trying to just walk. And then usually there's often a lot of swelling of the knee that develops soon afterwards. Just the knee turns into a balloon sometimes. That's kind of a bummer of an injury. It's one of the most researched surgeries in all of orthopedic surgery, and how to do it and how to do it well. There's constantly developing techniques. I'll probably make a video about this one of these days. But the tendon often has to be, or the ligament rather, has to be reconstructed, meaning you can't just repair it. You have to reconstruct it, make a new one using tendon from usually within the patient's body, but you can take cadaver tissue too. And rehab, maybe you can start getting back to jogging and doing certain things at 6 months. It's usually at least a year before they return to full sports. But there's some researchers out there showing even it could be 2 years before they're truly, fully recovered. Going into kind of the hand specialty that I see things a lot, certainly punching things, but football and other contact sports, the broken metacarpal. The metacarpal bones are kind of the longer bones of the hand. They're kind of the springboard for our fingers, if you want to think of it that way. And classically, the boxer's fracture, the fifth metacarpal neck, which is a portion of the bone that's closer to the knuckle and it breaks. We are all taught when we're punching things that we should be trying to land our punches kind of more on the index finger, middle finger, when we're throwing that straight punch. But the opponent moves, we have bad technique, whatever it is, and we land the punch on the outside of the hand, and it breaks. For the most part, we don't need to operate on those fifth metacarpal fracture necks. It just takes time. It usually takes about 6 weeks for the bone to be healed. And usually we can start range of motion and other things like that before that. And then when it's all said and done, when they make a fist, they'll notice that the knuckle's a little pushed down compared to the other side. Yeah,
I've done that. Been there, done that.
Yeah. It's a really common one for people who punch things. Another pretty common finger injury is a sprain, and I often have to counsel people the finger joints. So you have the metacarpal phalangeal joint, where the metacarpal joins up with the phalangeal, and the next joint down, the proximal interphalangeal joint, which we just call the PIP joint. It is a joint that's really important for your function of your hand. It's kind of the most important joint of your fingers as far as coming down and making a fist. And so people really notice when it's not working right. But injuries to that joint, even if it's just a little sprain, it's going to be swollen and painful and stiff for months. I often tell people a sprain is going to be 3 to 6 months before you're kind of not thinking about it anymore. And it's a commonly dislocated joint, especially if you're kind of posting your fingers out and kind of get hyperextended. I'm seeing it a lot in the mixed martial arts athletes where the gloves stop right below the PIP joint. So there's a little extra force when they're putting their hands up to maybe block something or catch something, and the finger gets pushed back and it will dislocate. And important, of course, to relocate the joint, but the joint will be stiff and painful for a long time after those injuries, even if the joint's lined up perfectly. That's definitely one that I have to talk to people a lot about.
All right. And a little bit earlier, we talked a little bit about, influencers and so on, talking, I wouldn't say out of their asses, but just basically giving very limited information that doesn't apply to everybody. What are some of the myths that you see out there in the combat sports world, or stuff that you might hear training partners say, like, look, this is actually not a thing, or no, please don't ever do that. That's not medical advice. And I'll give you one. A while ago, one of my students, one of my MMA students came in, and we were talking about something, and I said, look, you don't do that. You don't want to take all this head trauma, all these impacts. You want to block like this and not like that, and so on. And he says, yeah, but it's good to toughen up your brain. And I'm like, no, that doesn't work. CTE is a real thing. You cannot do that. And just recently, I posted a video on my Instagram where you see this coach just punching this lady in the face, not full force, but way too hard anyway. And I was like, another idiot who doesn't know CTE is a real thing. And one guy got very upset, with me about that. Obviously I'm a fraud. I don't know anything. I'm an amateur. Go talk to a professional. Blah blah blah. I'm like, dude. I mean, vaya con Dios. All the best to you and your students, because they will eventually have to pay a price for that. And it's, to this day, you see people thinking that you can toughen up your brain and get used to getting punched in the face. I mean, psychologically, I agree. There's a case for that. You get a little bit used or less shocked by the impact itself, that you know how to fight through that. Okay, but the damage is there. It's not worth it. So is there anything like that you're like, please folks, don't do that?
There's definitely a few, but just to keep going with kind of the brain trauma thing. It's clear there's no such thing as good head trauma. It's never good to have your brain sloshed around inside your skull, and the brain does not get tougher to those things. And now the CTE thing, it's still being researched, and we there's a lot we don't know.
Yeah.
And there's probably a lot of factors that go into it. How many punches a guy can take is probably influenced, one, by their genetics, but technique and how many times they get hit and all those things. But it's clear there's a limit to how much your brain can take getting hit. And it's going to be different for everyone, but why test it? Why, you've got a bank of headshots that you can take before bad things start happening. Why use them up on those things? And you see it all the time in combat sports where a guy just loses his chin.
Yep.
It's not like his brain isn't tougher, it just, there comes a point where you've taken too many headshots. A guy who's taken 1,000 headshots that are concussive, and then all of a sudden that same shot that they used to be able to walk through, it takes them down. So there's no such thing as good head trauma. It's not making you tougher. But there's a lot that we got to learn about CTE. And along those lines, yeah, there's probably a few people out there who need to learn it's okay to get hit if they want to be successful in striking sports. There's those people who are just terrified and ducking and blinking and moving way out of the way as opposed to slipping, and maybe learning that okay, if you get hit a little, like you're going to be okay. You can stay in the fight and counter and those kind of things. But it's not a matter of training them to have them their arms down at the side and just punch them in the face. There's better ways to teach people how to get hit. But yeah, so kind of myths out there. There's a lot. I guess the first thing that pops in my head is around supplements. And there are a lot of supplements out there, and I'm not a nutritionist, but my general statement on this is, if you're sleeping as much as you need to, you're recovering like you need to, if you're eating a good diet, getting the protein and the other nutrients that you need to get, you're staying hydrated, you've taken care of probably 95% of what you need to be doing on that realm. And now certainly if there's people out there who've done a lot of research on getting enough protein. All right, protein shakes, great. Things like creatine, there's probably a benefit to it. I'm not an expert, but those are fine. But then we start getting into these these very niche things that there's no real research on. Maybe there's some stuff done on rats or mice, and maybe it showed something really cool, but the doses that the rats were getting were amounts that are way more than you would give a human, and in conditions where you're not going to subject a human. And they dive head first into it, and it's kind of scary. And then there's these influencers out there who start talking it up, and worst case scenario, you're losing money, or rather, not worst case scenario, best case scenario. It's just kind of, you're losing money. Your wallet takes a hit, and your body doesn't take any damage. But there's stuff out there that is harmful at the wrong dose, and you got to be careful. And some of it's illegal, and a lot of what you're buying online through supplement companies is not checked by the FDA. You don't know what you're getting in some of these supplements. So I would just say caution with a lot of the supplement world. That's my standing on a pedestal with supplements.
No, that makes perfect sense, because I mean the supplement industry didn't used to be as big as it is now, but now you've got basically, for whatever you can imagine, there's supplements out there. And like you said, the research is often very inconclusive, or typically what you see in the marketing material is they take research that has maybe like 1% of the final claim that they make is valid, and they just inflate it with 99% of exaggeration to get to the point where they make this claim of like, this supplement is going to help you with X, Y, and Z, and then legally they're covered because somewhere in the small print it says actually study blah blah blah, but nobody reads that. So no, the supplement industry is it's a special case.
It's a weird Wild West kind of chaotic kind of thing. And there are some good supplements with good companies making them. And I would encourage you to try And then just because something helps in a little dose doesn't mean that you got to do a crazy dose, but try it out, experiment on yourself, see how you respond, and go from there. Treat your body as a lab if you're going to start doing things like that.
And what I often suggest when clients ask me that is that, look, go get some blood work done, see if there's anything lacking mineral wise, vitamin wise, and so on. Just go see your doctor and ask him to take a look and see if he suggests like maybe taking certain supplements or certain things. You might be low in iron, you might be low in this or that.
Yeah.
And then, like you just said, get a good night's sleep every day and eat healthy, eat well, hydrate, exercise, and more often than not, things will take care of themselves. And if it isn't the case, at the very least, you're not just blindly throwing darts at a board, hoping to get the right supplement. Just get an assessment. It's not rocket science.
Yeah. No. I mean, it's intuitive. It makes sense. But not a lot of people do it. Yeah.
All right. Any other myth that you want to debunk?
Well, I guess another thing that popped in my head is the world of stem cells. A lot of interest in it. Some big names talk about it, whether it's Joe Rogan or whatever. And so stem cells, there is a ton of potential in stem cells. These are cells that potentially could turn into anything you want them to turn into. And so, for arthritis that we were talking about earlier, if you could somehow have these cells make new cartilage in your joint that holds up, awesome. If you can inject some stem cells and regrow a rotator cuff when you've torn a rotator cuff, that would be amazing. The applications could be, if we're able to harness stem cells, you could do away with organ transplants, needs to do organ transplants. The potential, if we know how to use them, is amazing. At this point in time, we don't really know how to use them. If anyone invents the cure to arthritis, they're going to be a trillionaire and win the Nobel Prize. No one's keeping a secret. So yes, people are using stem cells. Maybe the research is showing that there's some benefit in faster healing or reduced pain, but it's not a game changer yet. It's not revolutionizing the way I do my surgeries. And if it did, I would offer them and use them, but we're nowhere near there yet. The process in making articular cartilage, the cartilage that makes up a joint, is talking about nuance. There are so many steps going from embryo and fetus to young child and how they bear weight, crawling to standing to, as we're a young adult and our bones mature and our growth plates fuse. There's so many steps that go along the way to the development of articular cartilage that just thinking you're going to take these stem cells and throw them into a joint and they're going to turn into articular cartilage, it doesn't work that way. And anyone who says it does is lying. And that is a treatment that is very expensive. So if you've got the money and you want to find that little edge that maybe helps you heal a little bit faster, have a little less pain, hey, it's your wallet. But man, there are so many people out there who are spending the money they don't have on treatment that is not going to appreciably change your outcomes. So that's that about stem cells.
Yeah, I asked my friend the surgeon a while ago because I have stage 4 arthritis in my left knee and stage 3 in the right, and we did PRP shots a while ago,
Okay.
and that helped quite a lot with me, and then some recommendations for him, specific stretching and straightening that I needed to do made a huge difference for my knees. But we talked about it. I said the exact same thing that you said. Is that there's a lot of potential there, but right now you can inject it into a knee, and what do we see? That it might go anywhere in your body, those stem cells, and not necessarily do much for your knee. So at this stage, and this was maybe 2 years ago, he says at this stage it's just not there yet.
Yeah.
I'm sure there are people who for whatever reason get stem cell treatment and that it works wonders for them. I'm sure, but that doesn't change the fact that for a bunch of other people, it's just like you said, very expensive treatment that may or may not help you, and the science isn't really there just yet.
Yeah,
Talk,
it's not there yet. A lot of
yeah.
people working on it.
Talking about science, I mean, just one more question for you. What are some promising treatments that you know for injuries that are available like right now, like new stuff, or that you know are coming down the pipeline relatively soon, if there's anything?
Sure. Yeah. I mean, so again, things like stem cells, they're exciting. There's potential. We'll see what happens with that. But I do anticipate there'll be something that clicks where we're going to be able to use them better. You mentioned PRP for your arthritis in your knees. I think there's some potential in that PRP, platelet-rich plasma. We're harnessing the platelets that are in your blood. These are the cells that are most known for creating kind of blood clots. But they're a huge part of your body's initial healing response, the immune response to a trauma. And so we think maybe by harnessing that, we can kind of push healing forward. Makes sense for tendon injuries and chronic tendon issues, whether it's tennis elbow and things like that. A lot of research still being done. Arthritis, it's being used for, and there's some stuff out there saying it's helpful for the pain, but it's not regrowing cartilage. And mechanisms behind the pain relief and anti-inflammatory effect still being parsed out. So, but those are two things that there's reason to be excited. Hey, if we can take things from our own body, modify it just slightly, and put it back in you, that sounds awesome. There's always innovative surgical techniques that we're using. A philosophy change within the world of orthopedic surgery has been trying to get patients to start moving much sooner. You know, we talked about a broken bone often taking at least 6 weeks, sometimes 2 months to heal in ideal situations. But with the fixation that we're getting with some of these newer implants, whether it be a plate and screws, that the screws especially lock in a certain way, or the nails, we're using them in different bones, but we can get really good fixation. We can start letting patients move much sooner, which prevents stiffness, and you get early recovery. And those are some exciting things that are coming. There's harnessing not necessarily stem cells, but embryonic tissues, using some of those to maybe push forward healing. I think they might be helpful for wound care, chronic wounds that just aren't healing, whether it's in those diabetics or you're trying to take someone who's elite and get them faster to that point of healing. Maybe there's going to be some applications for that. And then there's some implants that are somewhat, we've talked, you know, bone needs rigidity to heal often. It can't be moving around to heal. But certain things like tendons or ligaments, they're made to move a little bit. And so we're reinforcing some of our repairs with things that can move, kind of these suture techniques that I find particularly exciting and helpful, getting strong repairs, but allowing for motion.
Nice. All right. All right. I think we covered a fair bit of ground, and I'd like to go over to the bonus part for my patrons. But before we
Okay.
leave, is it, any parting words, any advice, anything that you want to share with the audience?
Sure. So, well, I would encourage everyone to find the thing they really like doing, and go after it. And it's okay if it changes. Find another thing you really like doing. Stay excited and passionate about the things that are in your life, and you can do some really cool things.
All right. Excellent. Where can people reach you?
Yeah, so I've got my Instagram channel, Dr. Lucius, even though everyone calls me Dr. Luke, Dr. underscore or Dr. underscore Lucius. I'm putting some content up there fairly regularly, hopefully inspiring people and educating people. I've got a YouTube channel titled Cut to the Bone, where I'm putting more long form and hopefully slightly more nuanced stuff about injuries that we were talking about. And then, you know, I'm out there on other things, but I try not to get too into my phone and pay attention that much.
All right, but I'll put the link. I'll put all the links in the show notes so that people can look you up and find you there. Dr. Luke, thank you so much for taking the time for this. This was awesome. I learned a lot, and I'm pretty sure the audience did too. Folks, we're going to head on over to the Patreon. There will be a link in the show notes to this bonus part where my patrons have some interesting questions for you. So
Let's
we're
do
going to
it.
head on over to there.
Thank you for
Thanks
having me.
again. It was my pleasure. Everybody, we're out. Talk to you next time. Bye.